I think we're going to just push straight through to the panel and then give people a little bit of extra time at the end of the day on their Friday, which I'm sure no one will have problems with. So if everyone could go ahead and get ready to answer some questions. And Vivek, I'm going to give you a warning. The first one is for you. So you said after 2 weeks of sleep deprivation, animals die. So we don't do this type of research in humans. Do we know why animals are dying?
You know, most of it is obviously it's not known because they just wanted to study this population. But obviously, there's this whole inflammation pathway that gets upregulated. The anti-inflammation pathways get downregulated. So one thought may be that there's just too much, or there's too much energy consumption because of prolonged wakefulness. Uh, I think the animal society will not allow us to do those kind of experiments anymore. You know.
Seva, do you have any additional thoughts on that?
Yeah, I agree with Vivek. It's inflammatory. There was some notion that maybe because it was some of these models, they were associated with force exercise. They were, some of these models, so they were just put on the wheels, and it's a several experiments, right? There, the classical RNK experiment. Basically, as Vivek talked about it, there is a energy, basically the energy disbalance. They wasted more energy than with the sleep deprivation rather than consume. But and systemic inflammation is an outcome, and wasting. Yeah.
Any other thoughts on that? All right. Liza, you're the next question, but obviously I will open this up to everyone. What amounts of irregularity was correlated with health issues? Namely, what or how many hours or minutes of variation counts? Like, how far off do you need to get before this starts being a problem?
Yeah, I actually don't know the exact answer to that, and I'm not sure if anyone does. I think it's an area that people are starting to look at, and actually the variation has been looked at in a few different ways. There's variation in your timing, right? If you are sleeping 8 hours, but it's at different times. There's variation so that people may be looking at mid-sleep point and seeing the variation there. There's variation in the duration of your sleep. The variation in bedtimes, variation in wake times. I think there's actually a number of different parameters, and I think we have a lot more to learn about exactly what it is we should be paying close attention to. So I don't know what counts at this point in time, but I think trying to anchor sleep at a relatively stable time is beneficial, but we can't say exactly what that is.
Any other thoughts on that?
I think one thing that could be cool to think about too is the variability in sleep and everything is starting to be seen as a predictor of disease onset. And like Dr. Ashbrook may disagree with me, but I think that's a cool place where the field is going that I think might be interesting to look at.
Yeah, absolutely. I mean, this is potentially something modifiable, but maybe it's in fact a consequence, right? These are correlation studies, those last 3 studies we talked about. So absolutely, it could be a disease marker, and it probably is in some cases.
Just makes it all the more difficult to study, right?
Just gives us more questions to answer.
There you go. More fun research to do. I like that. All right, Lauren, the next one is to you. If pain medication is administered, does that impact the lymphatic system?
It's a fantastic question. We've done a lot of work with anesthesia and how that might affect the lymphatic system. We've done some work with somnolence and how that might affect the lymphatic system. Basically, we've been finding a fun correlation between how the drugs affect neuronal firing with how all the fluid can get into the brain. And there was actually 2 recent papers that just came out in Nature that are asking how neuronal firing may change localized clearance in the brain. And one says like 40 hertz stimulation is really great for the cortex, and the other one says it doesn't matter what it is as long as it's synchronized in the hippocampus. And so my answer would be, yes, drugs probably affect lymphatic clearance, but there's starting to be this idea that it may affect region-specific clearance, which could be fun.
Very interesting. Anyone else have any comments on that? To be determined.
Mhm.
All right, Seva, next question, I'll start with you. Is the hypoxic burden greater for patients with compromised medullary reflex center, like in Arnold Chiari malformation?
Yeah, that's a good question. Well, that's obviously unknown. It requires, it depends on severity of apnea. Patient with Arnold Chiari, they're predisposed to both central and obstructive apnea, and degree of desaturation usually is in this patient depends on two things: how profound their dislocation or herniation is. That's basically is dislocation of the medulla essentially to the spine, right? So, and depends how profound it is. And secondly, it depends also on their weight, because if it adds to obesity, then the obesity is added on the top of it, they desat more. So basically, short answer is I don't know. Long answer is it depends on both severity of malformation and comorbid conditions.
Anyone else have comments on that? I thought that was a pretty good answer. That was a complicated question. All right, Vivek, next question. I'm going to start with you. How does waking up to go to the bathroom affect sleep, and how can you reduce this sleep interruption?
It's lots of sleep continuity, just like many other conditions where, physical conditions which can disrupt sleep, not sleep conditions like sleep apnea, which is also kind of a sleep deprivation, but, people who have asthma, cough during the night, that interrupts their sleep. So, bladder issues that wake people up are causing sleep disruption and in a way, sleep deprivation. One thing which is interesting is that sleep apnea itself is also associated with nocturia, and many times people don't realize that, and treating the sleep apnea, which is non-bladder, not the primary source is not the prostate or something else, can also help decrease nocturia. So I hope that answers the question. Yeah.
Any other thoughts on that one? That one's maybe a little more straightforward. Okay, Liza, I'm going back to you again. If brain clearing happens between certain hours and other health factors relate to non-night owl lifestyle, how does that square with figuring out your own circadian rhythm and following it, particularly if it is on the night owl oriented end?
So I'll defer to Lauren about brain clearance happening at certain hours. I mean, we think about it during certain phases of sleep potentially, but that's not time locked to certain hours. It's more about your sleep need at the time and previous sleep deprivation potentially. So that is not time locked and would happen at whatever time you're sleeping, especially potentially sleeping at a regular time. So hopefully that answers the question, if I understood the question properly.
Yeah, Lauren, you want to comment on that?
I mean, I think part of the question was also like, I don't know, it's fine. There is an underlying rhythm to lymphatic function. So there is a timing component, but it's only explains like 10 or 20%. So I would totally agree with Dr. Ashbrook. Like, if you need to sleep, you will clean the brain. It might be 10% less efficient than when it would normally want to go.
Right. So the most important thing is getting sleep.
Yeah.
Preferably restorative sleep when you can.
Yeah.
Anything related to that? All right, and move on to the next question. Seva, and also probably everybody can comment on this one. Do you have any tips for improving adherence to CPAP, either for patients or for providers?
Yeah, well, I'm sure Vivek will contribute as well. But my answer is, first of all, the main factors is actually a supportive environment at home. This is very critical. Then this is the first thing. Second is support in the sleep center or DME company, so which accommodate with the adjustment of make sure the mask fits and make sure that patient is instructed how to use it well. It's interesting. The other factors that really do not play much a role, like nasal mask, full face mask, or another thing. And third thing I forgot: make sure your nose works well. So to fix the nose. Somebody, I'm not sure who told me this expression. Fix the nose. No, what's fix the nose is fix the hose. So that's right. So a hose means the CPAP machine, obviously.
Yeah.
So there's three things. Vivek, anything else?
Yeah, again, Peter, as Seva said, many things have been tried. Different, masks don't really make a difference. Psychological component is huge, right? I mean, they have to have support, as you mentioned, both internal themselves, they need to be, ready to use CPAP, and have family support. Like, if they say, oh, my girlfriend is opposed to my CPAP, then, what else can I do?
This is it. Yeah.
That's true for so many things. It's true for weight loss, right? It's true for almost everything in life. You need to have support and belonging to really make things last. Any other comments, Liza?
I agree. I think support with those providing it. I mean, we often will change out masks and change out settings. And also I think there's, kind of some motivational part on the side of the patient in terms of feeling committed to actually doing it, which includes the support of the family. If people are trying their PAP machine on once every week, they're less likely to be successful. So certainly we think a lot about that in sleep clinic.
Great. Okay, next one we're going to start with Vivek, but we'll go to everybody. Stress. We've all got stress. How do we deal with the impacts of stress on sleep?
But decreasing the stress. There's no, I mean, that's physiological, right? So, there's good stress and bad stress. So, good stress is important to achieve things, but sometimes it becomes pathological, and then you have to realize that it's going to have an impact on the body, whether it's on sleep or exercise or diet or timing of sleep or whatever. Then you have to go back to the basics and say, no, I recognize that my stress is going to impact my sleep, so everything else should at least be the things that I can control should be controlled, right? So if it's light exposure at night, I have to minimize that. If I have to not have my work in my bedroom, I should minimize that, right? So, if stress is not controllable, factors that can be controlled can, don't eat within 2 hours of bedtime, exercise if you can get time, so that, exercise does help sleep. And I don't know if it helps lymphatic clearance. I should have asked Lauren that question earlier. But, so just, follow the simple other sleep hygiene tips. Yeah.
Any other thoughts on that?
Yeah, that's exactly. Stress frequently triggers insomnia, and that's important to eliminate the trigger. But sometimes it's difficult. It depends on life circumstances. But because then it's perpetuated unless the trigger is removed, it's really hard. But so that's what Vivek said. Try to kind of minimize it and eliminate if it's possible. Sometimes people have to change their jobs. It's not like I'm telling everybody to change their jobs, but that's true, and that may contribute. Yeah.
Absolutely. I'd also point out that this sounds very much to me like we need an integrative approach, and we need to look at the whole person. So we can probably drop in the chat the Resiliency and Wellbeing Center worksheet, which will help you work through some of these things, because you really need to be kind of supporting it from all angles. Nutrition, stress, physical activity, your support system, all of that is going to affect your ability to sleep, and vice versa. Sleep is going to affect those other things. So you kind of have to work on every little aspect a little bit, which sometimes can seem overwhelming, but hopefully we've broken that down for you. So we'll put that in the chat. But in a related question, so when we're sleeping, memories are processing, and we also have these dreams. How do dreams relate to memory processing and sleep, if they do at all?
That's a very controversial question. Some researchers do believe that REM sleep during which we dream, which again is not necessarily true. We can also dream during non-REM sleep. But REM sleep was, some researchers, their work showed that REM sleep was more highly associated with memory consolidation. Other researchers have shown it's just total sleep, doesn't matter what kind of sleep. I gave the example during my talk that people who take antidepressants don't have any REM sleep or can have very little REM sleep and yet have pretty decent memory at most times. So again, now going back to the question about so what is dream? And that's an extremely philosophical question. What do we dream? What is the content of dream made out of? I have my own bias, which is that when we have a exposure to a content during the daytime, and that content triggers multiple associations right away, and then 90% of those associations are rubbish and not really related to my after I've processed that content in my brain in a logical manner, I prune out a bunch of stuff that is not needed or it's illogical, and then how do I get rid of that? I get rid of that during dreams. That's my logic, my thinking about why we dream certain strange dreams. So it's a good thing that it helps prune the synapses and it helps prune some of the illogical content that we were thinking about during the day.
Any other thoughts on that?
Just a little thing. Yeah, I completely agree with Vivek. Just a little thing. Well, maybe it's not so little. We have to be vigilant sometimes in approach to dreams, because nightmares, especially recurrent nightmares, that may be sign of PTSD, which should be addressed and treated. And as we know now, PTSD can be triggered by all kinds of different experiences. So, and that's, just this point.
Excellent point. Okay. So we got a bit of a follow-up question on the animals dying of sleep deprivation here. They said, actually, my question was about why the animals died with 2 weeks of sleep deprivation. I wondered if EEG recordings or sleep parameter recordings changed in these animals before death.
That's as far as I remember, because this is Refschaff and Kale's paper.
That was a very old 60s
study. I don't think they
had
EEG recording. I don't think so. Yeah, I don't think it's been done.
And probably won't be at this point, I'm going to guess.
Yeah, I don't think so.
Okay, next question. With cannabis and THC legalized in many states and therefore access being greatly increased, how do you see this impacting the quality of sleep? And I'm going to open that up to whoever feels excited about it.
Well, this is a kind of humor me, please. When I walk out from Rose Building, it's so much cannabis in the air, I don't even need to smoke. Everybody has to be studied. Then what's going to be placebo? I don't know. Stay home, I guess. Sorry.
But you're right, and it's not just that location. I was in Charleston this weekend. Same thing. It seems to be the case everywhere. It's very popular, and do we fully understand what effect, if any, that's going to have on sleep?
There is some cool work looking at PTSD and cannabis to treat sleep disorders. And there's some cool work where they're asking, like, okay, what parts of sleep are you trying to treat and what strain of weed are you using, which is a whole other different issue with cannabis research. It's federally regulated still, but strains are going crazy. And so how do you actually see what the patient is using versus what's federally? And in Oregon, when I was there, they were actually paying for Ubers to bring people to campus after they had smoked so that they could get the effect in real time. The other thing, like, there was a survey going on in Oregon, because I was there like right when weed got legalized. the survey was going around of what sleep problems do you have and which strain of weed do you use to treat it? And it was just people reporting how they've been dosing themselves.
Mhm.
Yeah, I
Um,
mean, that's most of what's out there now, it seems, is, you know, not formally researched information. And so we need much better research. I mean, I certainly, if patients come to me and they're using marijuana and they're benefiting, I don't tell them, you know, that we know of really negative health consequences.
Yeah.
But there is some evidence that may decrease stage 3 sleep, similar to benzodiazepines. And so I don't recommend it for patients who aren't, you know, don't come to me using
And
it.
that's the THC component, correct?
I don't know. I don't think we know well enough. We don't have enough data.
I know I've seen some research showing that CBD does not seem to disrupt sleep architecture, but then you see that it is happening with the medical cannabis, which leads me to believe perhaps it's the THC, but you know, that's not the most precise research
There's
either.
also like hundreds of cannabinoids.
Yeah, exactly.
Yeah, yeah.
Exactly.
The pulmonary side of me intuitively doesn't like when people smoke. No matter what
Yes.
you smoke, it cannot be good.
Agreed.
Because we're supposed to breathe air, not, you know, and sooner or later something bad will come out of it, like with tobacco, right? I mean, I
Mhm.
prefer different routes of the people use different routes of administration. You know,
Yeah, I agree. And when it's recommended in the integrative medicine field, it's almost exclusively recommended for oral use or suppository, never smoking, because there are clearly going to be side effects of that. Now, maybe they haven't been as well established as they have for tobacco, but we can surmise that it's not going to be that different. Good question. How does chemotherapy affect sleep cycles? We know sleep is really important, and it's certainly getting disrupted in a lot of patients who are going through chemotherapy. Is it the chemotherapy or what is going on there?
I know there are some fascinating research. I think it's not the question, but I'll answer you. There is some fascinating research that the outcome of chemotherapy depends on circadian phase when it's administered. I think there was some high-profile papers, and maybe people who know experts, more experts, Elisa or Lauren, maybe comment on.
I don't know. Have there been like clinical trials? Because a lot of that's in cells right now.
I think something has been done somewhere. I think there's.
Yeah,
I'm not sure.
there's some literature. I mean, and not surprisingly, right? Cell turnover happens at certain times of day more than other times of day, depending on the organ and and what the area affected is. So it's not surprising that chemotherapy may be more effective at certain times than other times. But yeah, I think it isn't in an implementation phase yet. But I think there's definitely a growing body of literature suggesting that maybe we're headed there.
Well, that sounds like a bit of a symptom of the fact that we have historically kind of ignored circadian rhythms and just been like, are we doing it during the day or during the night? And I hope that that's good enough. But I think it's pretty clear that that's not good enough for certain things. And it sounds like chemotherapy may be one of those for this type of research.
But going back to the the question, I tell you anecdotally, we had a case just a year ago where somebody came after chemotherapy for breast cancer and swore that she became a night owl after she got chemotherapy. She had never been a night owl before that, and we looked up, PubMed and stuff like that to see if there was any known effect of chemotherapy on circadian rhythms, and we couldn't find anything where people have just looked at that. And she just swore. She said, "I'm a night owl ever since I got my chemo."
Interesting.
Very interesting. Yeah.
Well, if anyone else out there has other cases of this, then perhaps we could put a case series together.
I know here there's a whole cancer control group that's looking to see how timed activity can improve lifestyle and sleep in patients. So they're working on it here, but I don't know a whole lot about it.
So they're sort of trying to strengthen the circadian rhythm.
That's the idea.
That makes sense. That sounds, I mean, that would be beneficial in many people, as well as people who are going through chemotherapy.
So they are putting, activity monitors on cancer patients and seeing how their activities look and if they can reinforce them.
Excellent. I've got a follow-up question here about nocturia. Anything recommended for mitigating besides the obvious of not drinking before bed?
look for the cause and treat the cause.
Yeah.
Go to the urologist, don't drink alcohol, treat the sleep apnea.
Yep.
Yeah.
Okay, got a question here about melatonin supplementation. How much melatonin supplementation closer to bedtime would have melatonin holdover in the morning? So I'm thinking this person's using it maybe how people typically use it is sort of closer to going to bed, you take the melatonin, and it's really more to help you sleep.
Yeah, I'll start with that one. I mean, I think traditionally we've thought of melatonin as having a very short half-life. But actually just before this, I was with a rep from a company testing dim light melatonin on set and was showing us many, many examples of individuals who've had testing who stopped their melatonin a day or two in advance, but still had maximal levels. So I think it may well be that oftentimes people are getting higher doses than they expect, or maybe that's not perfectly explained why those levels were so high. But in the data that I was sharing, 10 milligrams of melatonin was still having circadian impact in the morning time. And many people feel some kind of hangover effect from even like 3-5 milligrams of melatonin.
I have a question for Lisa, actually. Do you put your patient with diabetes on melatonin, or?
Yeah, I know there's a small amount of literature, but I think it's mostly like much higher doses of melatonin. So I'm not aware of anything suggesting that like a low dose melatonin would be harmful for patients with diabetes.
And now we talk about melatonin extended release, which is even worse. People think it's going to have a longer duration of action, but like you said, it's going to have a hangover effect.
Right.
It sounds like more of a marketing thing rather than a science thing.
But I mean, melatonin is lipophilic. It can sit around in fat, right? Yeah, I'm pretty sure it can sit around in fat.
Well, that would help explain some of those lagging from several days effects.
Yeah.
Interesting. All right. Well, that is basically all the questions that we have, unless any are coming in now. So if that's okay with everyone, I'm just going to go around with final thoughts, and I'm just going to go in the order that we spoke. So Vivek, please, final thoughts.
To follow the tips that you've learned today. Try to maximize timing, or optimize timing rather, maximize duration. And if you have any thoughts that you may be suffering from a sleep disorder, please come to any one of us or any of your local sleep physicians and get it checked out. Sleep is
Absolutely.
important.
Get professional help. That's always a good advice. Seva.
Yeah, think about sleep apnea. It's very common. If you have it, if you think you have it, come to us, get diagnosed, get treated.
Absolutely. And I can attest that it's not that bad. You do have to sleep somewhere else, but it's just one night. Lauren.
I think I would like to remind the idea that sleep is important for brain health, but also things that are going on in your body other than sleep can impact how you sleep. And so if there's something wrong, get it addressed, because pain or stress can impact how you sleep.
Excellent. And Liza.
Sure. I will reiterate some of what's been said. I mean, as I discussed, sleep timing and following your body's cues about what's best for you on duration and timing is vital. But if you're really dissatisfied and you're having a lot of complaints, seeking out help. And there's a lot of sleep medicine folks out there who can provide guidance. And I suppose to address, I think there was, maybe I didn't fully address the question about figuring out what is your own timing. Sometimes you can follow your body cues and determine that, and sometimes it's less clear. There's a few questionnaires out there that people find useful. The Munich Chronotype questionnaire and the Morningness Eveningness questionnaire by Horn-Osberg are two that are commonly used in research, but you could apply to yourself to get a sense of your chronotype.
Excellent. If you wouldn't mind sending us that information so that Janet could send it out to everyone, I think they would appreciate that. And with that, I will thank you all so much. That was fascinating and I think very helpful. Hopefully people are taking home a few things that they can try themselves that will help improve their sleep or maybe help their patients sleep. And with that, we will end.
Thank you.
very
Thank
much.
you, everyone.